Special thanks to the people who have made the production of the American Health Journal possible.
Toshiba Medical Systems, providing physicians with imaging tools to improve diagnosis since 1914.
This program has been presented in part by Ledesma and Meyer Construction. Building for a common vision.
And special support from Southern California Physician Magazine, the official publication of the following medical associations. Southern California Physician Magazine, the magazine physicians read.
The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to this very special edition of the American Health Journal. I'm your host, Roger Cooper. It's the disease few people have ever heard of. Do you know what von Willebrand disease is? Would even your doctor be able to spot its symptoms and correctly diagnose von Willebrand disease? It's the little-known disease that lots and lots of people have. Next on the American Health Journal. It is named for the Finnish doctor who first described it back in 1926. Dr. Erik von Willebrand of Helsinki observed a disorder in which people couldn't stop bleeding. We know it today as von Willebrand disease. And although many people have it, they don't know it.
I'm sure that you are familiar with some of the statistics that von Willebrand's is the world's most common bleeding disorder, and almost nobody has ever even heard of it.
There's definitely a lack of awareness in the general public, and there's even a lack of awareness among primary care medical providers.
It's the von Willebrand factor that is missing or defective in VWD patients.
If you're missing, however, von Willebrand's factor, the platelets don't go and don't bind to the side of the wall of the blood vessel that's broken. The blood keeps coming out and keeps oozing out, and you don't get a good clot that forms.
Von Willebrand's has 3 types, type 1, 2, and 3. Type 3 is the most severe type, and these patients have very little circulating von Willebrand factor, which is a protein that helps their blood clot. They have very little of that in their blood, so they actually act like a hemophiliac, where they would have joint bleeds, muscle bleeds, GI bleeds, things like that.
Type 1 tends to be the mildest form, and it is a quantitative deficiency of the protein called von Willebrand factor. It tends to affect maybe 80% of those diagnosed with von Willebrand's disease, so it's the most common. Their bleeding symptoms are milder. They tend to have only bleeding, not spontaneously, but with trauma. It can be mild trauma or moderate trauma, but they don't tend to bleed, as I said, spontaneously. Type 2 is more of what we call a qualitative defect. The number or the amount of von Willebrand factor in the bloodstream may not be abnormal. It can be, but it may not be, but it's actually the protein that is defective. Many of them may bleed spontaneously. Many of them bleed with trauma, surgery. Many are diagnosed after simple things like tonsillectomies, dental extractions. Those are the most common types of procedures that people undergo and have profuse bleeding.
In younger kids, we generally notice it more in the boys because they seem to be a little bit more rambunctious, more likely to get nosebleeds. But as we go and the kids get older, the more likely group that we actually see it is a person that has to bleed every month, which is our female patients. They get their menstrual bleeding once per month, and during that time, they may just continue to bleed excessively.
But on average, it can take 17 years for a woman with von Willebrand's to get the correct diagnosis for her heavy bleeding.
Oh, you'd be surprised. There are a number of women who have undergone hysterectomies for uterine bleeding, and about 30% of these women, 20% maybe, have a bleeding disorder.
Sometimes the hysterectomies are done even before a diagnosis is made, whereas other treatments would have been more appropriate rather than removing a woman's uterus.
There's a push to recognize it so that unnecessary procedures such as a hysterectomy is not done on a woman with a bleeding disorder.
But it's 1% of the population. That means that if you go, let's say, into an average classroom, okay, of kids in school, you're going to probably find that one of the people sitting next to you has it.
The last I've heard is it could be as common as 1 in 50 people, which, I mean, that is, if I think about my graduating high school class, there would be several. I mean, there'd be a handful of us. So it's really not as uncommon as people think.
Most people who have von Willebrand's don't know they have it because most doctors don't know about the disorder or very much about the disorder and think of it as being very rare.
More on the disease no one has ever heard of when the American Health Journal continues.
You're watching the award-winning American Health Journal.
What's it like to have von Willebrand disease? We met some patients who went years without knowing they had it.
I found out when I was like an infant, when I had the shot in my arm, it wouldn't stop bleeding. And it just went on and it went through my pajamas, and my mom took me to the children's hospital, and that's when they figured out I had von Willebrand's. It doesn't affect my life. I do dancing, piano, I do tap, ballet, I do almost anything. Nothing ever stops me from doing anything. I like to do soccer, but I just have to like put a lot of knee pads on me so I don't get bumps.
Tell me more about your school. What kind of grades do you get?
I get
A's and B's?
I try as hard as I can. If I bleed, I'd have to take Amicar, and I'd try to stop it as much as I can, and if it carries on through the week, then we have to call a doctor to come out and give me a shot, and I have to get an IV. At school, it's usually just my nose or just my teeth. Like when my nose gets dry, I have to put like Vaseline in it or something to keep it moist, or else the something in here will like crack and it'll start bleeding when it's really dry. Eventually it will stop if I get Amicar or if I get like an injection or an IV.
I have von Willebrand's, actually a special type of von Willebrand's called von Willebrand's 2B.
Walter Johnson is living proof that people can walk around much of their lives and not know they have von Willebrand disease.
I've had it all my life. It's something I was born with. And I inherited it from my mother, who I believe inherited it from her mother. And I was diagnosed with it when I finally retired in 2001, because I had to buy insurance. You know, for a long time, it seemingly had no effect at all. The doctors kept saying, yes, you have this disease, but its clinical manifestations are minimal. When I was 66, I tried to go water skiing and tore a muscle in my arm here. And that required emergency room, and they had to call I was up in the Midwest, they had to call Dr. Kwan and say, what do we do with this guy? He's bleeding inside of his arm, it's a problem. And so that's the first time I really had an incident that required some special care.
Well, I had open heart surgery when I was about 3 years old, and when I came home from the hospital, I started having horrendous nosebleeds. I would lose a pint of blood, I would bleed for 2, 3, 4 hours, and they would constantly cauterize my nose. My mom had no idea what was wrong. I was covered in bruises all the time, and we just went to so many doctors and emergency rooms and didn't have any answers until I was finally diagnosed at 11. So it was a long journey to diagnosis. It's an everyday something that I get to live with, and I've chosen to embrace it versus feel sorry for myself. And I do my best to be careful and not put myself in dangerous situations. I mean, for example, I work at a restaurant, so when I'm polishing glassware, I'm extra careful. I keep my medication close. I make sure that my friends and my family members are aware. You know, and of course we get the spontaneous nosebleed, so it's just a little bit of a nuisance and maybe a little embarrassing. However, I'm really, really grateful that I have the medication that helps me. I definitely know that I have a mild form of von Willebrand's disorder. We're not really sure if we got it from my mother's side of the family or my father's side of the family, because there's significant bleeding history on both. And all I know is that my medication works and I live a really healthy and active lifestyle. Not one to let my bleeding disorder hold me back from doing anything that I want to do. However, I do make special accommodations for myself. I'm a black belt in Taekwondo, and when I spar, I wear extra safety gear, and I'm not reckless, I just definitely take extra precautions. Well, I have 2 different medications. One, I have the nasal spray. So when I have a nosebleed or a bruise, something not too significant, I take it and go on about my life. When I have something a little bit more significant, perhaps a surgery, or if I were, heaven forbid, in a car accident, I have an infusion. So when people go and donate their plasma, they transform that donation into my medication through a series of processes, scientific processes, and then I come either to a hospital or my doctor's office, or when I was competing in Taekwondo, I used to give myself the IV in my living room or in the dojang and continue to move on with my life.
The story of how Misty and other von Willebrand patients get the factor that controls their bleeding when we come back. Now you can take the American Health Journal with you. The doctors you depend on for instant information are as close as your mobile phone. So go to ahjmobile.com and get the latest medical information you need.
And now back to Roger Cooper and the American Health Journal.
The precious factor that controls bleeding and protects von Willebrand patients is harvested from donated blood plasma. And a world leader in doing that is Grifols Biologicals. We talk with Grifols Vice President for Research and Development, Dr. Stephen Herring.
The VWD products contain large amounts of von Willebrand factor that is fully functional. And this is because they're prepared from the plasma of healthy donors. So these products can be infused into patients, and they basically replace the defective von Willebrand factor with a fully functional von Willebrand factor. The products are, they come as a freeze-dried powder typically, and they are reconstituted in a volume and then infused, meaning they are just injected into the patient's circulation.
The purified factor from Grifols will contain not only von Willebrand factor, but also what's called factor VIII protein, a clotting agent missing in hemophilia patients.
Interestingly, most of the VWD products contain not only von Willebrand factor, but also factor VIII protein. And this is a coagulation factor that is missing in hemophilia A patients. They are infused, and the intent is again to replace the missing or defective von Willebrand factor, and they're infused at a level that then will allow the patient to form the hemostatic plug that's required.
A plug that stops bleeding. Separating the von Willebrand factor out of blood plasma is an extremely difficult and demanding process that Grifols has spent decades researching and perfecting. Because it's from the blood supply, safety is prime.
Safety of plasma products, the plasma manufacturers over the last 25 years have been putting together more and more procedures to increase the safety and quality of their products. And with respect to a product like von Willebrand factor, for example, first, it's a very highly purified protein product. Secondly, every unit of plasma that is used in its manufacture is tested for the presence of bloodborne pathogens, and any positive result for any particular unit means that unit is discarded and not used in the manufacturing process. And then lastly, the manufacturing processes themselves include procedures that are intended to specifically kill or otherwise eliminate potential pathogens and viruses.
At Grifols, it takes hundreds of scientists to do this research and development.
In this industry, we're looking for biochemists primarily, because every one of the processes that we develop have some type of biochemical separation, some separation, some purification method that's based on the biochemistry of the different molecules. So we're looking for biochemists. When we look at plasma safety and some of the potential pathogens that could be there, we like to have on the team some molecular biologists, maybe some virologists to talk to. And then we also have chemists, because a lot of the testing that's developed involves straight chemistry, and so we like to have people with chemistry backgrounds. And actually you're looking here at the quality control facility, which is the testing facility that looks and tests the products after they've been manufactured. So we have both research and development, which is kind of ahead of the manufacturing side of things, and then we have the quality control laboratories, which actually, once the product is made, test the product.
Fighting disease in the laboratory takes years of very tedious work that can often lead to dead ends, but it can also be very rewarding.
I've been in this industry for 30 years now, and there are always ups and downs, but when I go home at night, my wife reminds me, and I don't usually forget, but she does remind me that I'm in the business and we're in the business of saving lives, right? And the products that we have and that we have developed here are used to save lives.
When we come back, how that life-saving factor manufactured at Grifols gets out to the von Willebrand patients who need it.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this PBS station.
As we've seen, the medications used in treatment of von Willebrand disease are difficult to make and can be costly. More on how they get delivered from our reporter, Laura Windsor.
Roger, once the manufacturer produces the factor and other medications that help control bleeding, those treatments have to get out to the patients who have to use them correctly. Becky Berkowitz is the nurse coordinator for Hemophilia Treatment Center of Nevada.
I'm the hemophilia nurse coordinator. That means I coordinate the care of all patients that have bleeding and clotting disorders for the entire state of Nevada. Our team consists of myself, the nurse, we have a physical therapist, we have a social worker and the physician, and sometimes a dentist that comes to clinic. These patients are given a thorough exam by the physical therapist to make sure their joints are functioning correctly and make sure they're strong, keeping their muscles strong to protect joints so they don't have bleeding into joints. The education for von Willebrand patients include things like the type of von Willebrands they have, how they got it. We talk about genetics somewhat, being that it can be from mom or dad. They have education as far as how they would treat the different types of bleeds they have, what to do in case of an emergency, where to go, who to call, what to do if they're going to have surgery or dental work, general signs to look for, things that we would consider an emergency like a blow to the head, things like that. I think the von Willebrand patients are very well educated. They're taught to be advocates for themselves from the time they're very young. We teach the children, not only the parents, that this is, we tell them that it's a minor inconvenience and it's a bump in the road and it's the hand you've been dealt. Living in Las Vegas, we use these kind of words, but it's the hand you've been dealt, and so let's deal with it. Let's make this the best it can be for your situation, because we don't want these girls to end up, having a hysterectomy at 13 or 14 years old because they're bleeding and no one's helping them control the bleeding. Or boys that are having nosebleeds that are lasting 2-3 hours. So a lot of it is empowering them to take care of themselves.
We make sure that all product is at the patient's house by 10 o'clock the next morning.
HF Healthcare is a specialty pharmacy that takes orders, gets insurance companies' approval, and then actually delivers von Willebrand factor to patients nationwide.
So we have the pharmacy, and then we have a great staff that are they're trained, and we're all about education. Education is so important because, again, we're not talking about a $10 medication. We're talking about a very expensive drug. And so you need to make sure that you know the ins and outs of all the drugs. It takes a team, and the team consists of the patient care advocate, your billing and reimbursement team, your operations from ordering the product, knowing the manufacturers, and then working with the insurance companies to getting the product out.
But HF Healthcare dispenses more than just medication. It fields patient advocates who make regular visits to von Willebrand patients in their homes. Patient advocate Jerry Farler himself has a bleeding disorder.
As a patient advocate, we are working very closely with the patients. We are also working closely with the pharmaceutical companies. We're keeping ourselves up to date with the medications that are out there, any trial medications that are coming out. If there are any reports of incidences with the medications, some reactions that may be happening with different people, we can take that information and pass it along to our patients, making sure that they themselves know what kind of medications are out there, and if there's anything that might work better for them to help keep their lives improved. We feel very important to pass along to the patients.
And it's definitely we team, not I. And it makes the we makes the wheels go around.
It does take a lot of people and a lot of education to keep von Willebrand patients leading normal lives. Roger?
When we come back, what's in the future for treating von Willebrand disease?
Need the latest news on the treatment for depression, addiction, or sleep disorders? Now you can go online at AmericanHealthJournal.com. Thousands of videos straight from doctors.
What's in the future for von Willebrand disease treatment? Large doses of public education and research.
One of the things that is being worked on in the research world of von Willebrand disease is to develop improved blood tests that are going to be simpler to perform and that will provide higher quality results. In other words, they will clearly say, yes, you have von Willebrand disease, or no, you don't have von Willebrand disease. Whereas now we have many patients who have bleeding symptoms that whose blood tests fall in between. Hopefully in 5 years, we'll have a much clearer, simpler way to diagnose von Willebrand disease, so we can tell a patient after we see them and do some blood tests, yes, you definitely have von Willebrand disease, or no, you definitely don't.
The way most patients are diagnosed is by the symptoms and by the family history. Those are the two main things, even above actual testing, to finding a bleeding disorder. And what one does is go through, is there any history of excessive nosebleeds, meaning have you ever had to be cauterized? Do you have more than one nosebleed a month? Do you bleed more than 5 days, 5 pads per day with your period? All these may be associated, and you go through. Have you ever been in surgery and had excessive bleeding? Do you have bruises that actually you can feel nodules underneath the skin from the bruises? All of the, do you get bruising in strange places without ever knowing why? All of these are questions that we go through each time in trying to discern whether or not a person might have a bleeding disorder.
There's even very good training programs in internal medicine, pediatrics, at highly reputable institutions. However, if those institutions do not have a hemophilia bleeding disorder center, then the physicians training there are not going to get exposed to it. Children's Hospital Los Angeles has a bleeding disorder center that we call the Hemostasis and Thrombosis Center. And as a result of having that designation, which comes with federal grant dollars, we are able to have a large staff that can take care of these patients as well as educate the patients specifically. What we need to do more of is to go into the community and educate the primary care providers that I just mentioned who are not necessarily aware of the condition, so that we can educate them about von Willebrand disease, about what are the signs and symptoms, such that once a patient shows up to their office with those symptoms, that they do think of the diagnosis and then refer the patient to us. One of our objectives is to really beef up all of the education that we can do to the public as well as to physicians.
I encourage them to go to work, go to the gym, work out 3 times a week, because it's been shown that healthy joints, good muscle tone will actually decrease the frequency of bleeding. So I tend to encourage them to participate in as many activities as possible. I truly believe that with proper care, prophylaxis, particularly in the severe patients, you can lead a normal life.
Von Willebrand patient Misty Brunmeyer has already decided to do her part. She wants to make spreading the word about von Willebrand disease her life career.
Yeah, I'm working on my Doctor of Management and Organizational Leadership. I just finished my first year of coursework. I have pretty much been an advocate and spokesperson for people with bleeding disorders ever since I was diagnosed, because I wanted to pay that forward and help other people who are bleeding and suffering realize that there's an amazing community and there's great medication and doctors. And so it's what I've decided to dedicate my career and my life to. So I really want to unleash a national awareness campaign. I'm sure that you are familiar with some of the statistics that von Willebrand's is the world's most common bleeding disorder, and almost nobody has ever even heard of it. So it is my passion, my purpose to change that significantly.
And that's this special edition devoted to von Willebrand disease. We hope you know just a bit more about von Willebrand disease and the people working to make its patients' lives better. To learn more about any of the topics on our program, you can call 1-800-303-3200. Until next time, I'm Roger Cooper for the American Health Journal.
Looking for the latest information on breast cancer, diabetes, healthy diets, or a new hip? Now you can go online at AmericanHealthJournal.com. Thousands of videos straight from doctors.
If you would like to order a DVD of today's American Health Journal, please call us at 1-800-303-3200.